Hello and welcome to Visionary Walks at I Want Second Opinion. Today we have got Dr. Karthik. Hi, Dr. Karthik.
Good evening, Dr. Prakash. Always a pleasure to be in these kind of talks with you, and I hope we have
Thank
a
you.
pleasant session today.
Thanks a lot. Dr. Karthik is a consultant surgeon with a special interest in laparoscopic surgery and also GI surgery. Today, the topic of discussion is upper GI endoscopy. Now, before jumping into this program, for the viewers, if you have not already subscribed to our channel, kindly do subscribe to our channel. That will keep us inspired and keep us going. Dr. Karthik, shall we jump into the topic straight away then?
Yes, please fire away, Dr. Prakash.
Thank you. Now, in layman's terminology, Dr. Karthik, what exactly is endoscopy? And in specific, the topic of discussion is upper GI endoscopy. What does it mean?
Uh, so, uh, Hi viewers, myself Dr. Karthik, and today specifically we are doing upper GI endoscopy. And so we'll start basically from what endoscopy means for those people who may not have come across this term until now.
Sure.
Endoscopy is nothing but several, even 20 years ago, doctors could not diagnose any diseases of the esophagus, which is your food pipe, and your stomach and your duodenum with any kind of certainty. We had to use crude methods, or in some kind of cases, only after people developed a lot of problems could you actually do an open surgery, and only then you will be able to visualize your stomach and esophagus. And even
Sure.
before that, they used to do, hefty cat scans and those kind of things, the CT
What's
scans,
that?
etc.
What
the
exactly?
the computerized tomography, the CT
Oh,
scan
CAT
machine.
scan, CT scan.
Yes,
Okay. Yeah.
CT scan. So, but 20 years back, after upper G, the endoscopy was invented. Endoscopy is nothing but a small kind of tube, which is 1.2 meters long, and it is left via your mouth. And basically, what it contains is it has a miniature camera at its tip, and using that upper GI endoscope, we can visualize our esophagus or the food pipe, our stomach, and even the first and second parts of your small bowel, which
Hmm?
we in medical terminology we call it the duodenum. And
Yeah.
but for other common people know it as the starting part segment of the small bowel. So up to the second part of duodenum can be visualized through this tube, and it has greatly simplified the diagnostic process. And now it is done as an outpatient procedure. And
Okay.
so that is what is basically an endoscopy means. It's a tube
Uh,
which visualizes your esophagus, stomach, and small bowel, and gives out the information on a monitor, which we can see and diagnose the diseases. Yeah.
right. Okay. Now, so why do doctors specifically use this upper GI endoscopy? Like, what are the reasons?
Okay, so by reasons, Dr. Prakash, you are asking me about the symptoms through which they present, or something
That's
like
right.
that.
Yeah.
Okay. So, as I told you, the three parts which an upper GI endoscopy is seen, gut
The
and
food pipe, the stomach, and the duodenum you were talking about. Yeah. So,
yes,
any
yes,
pathology surrounding this, any condition surrounding this part of
yes,
the GI system, you will be able to through that. Okay.
diagnose. Yes.
What about past the duodenum? Will the tube go past the duodenum at all?
No, technically the upper limit of it is the second part of the duodenum, after which the tube just the small bowel becomes extremely, like the loop cannot be negotiated using an upper GI endoscope. For
Sure.
those who are interested, there is something called as an enteroscope. It's called an
Okay.
enteroscope, which
Yeah.
can pass even beyond that and see something like, the upper half of your entire small bowel can be seen using that. But that's a bit cumbersome and an advanced investigation, which is not too much into an outpatient procedure, or as much easy as to do an office procedure like your upper GI endoscopy.
Sure, sir. Okay. Now, if I am the patient who is going to have this endoscopic procedure, how do you advise me to get prepared for this procedure? For example, if I'm going to have this procedure today afternoon, what are the things that I need to do, or what are the precautions, and how do you prepare me?
Okay, so usually this is given as an appointment, and we preferably do it in the mornings on an empty stomach. Like on the gastro side, as you might be knowing, most of the ultrasound scans and even the endoscopies, everything is done in the preferably in the morning on an empty stomach, and
Okay.
we ask the patient to come on a totally empty stomach in the morning, and he may
Okay.
have just a glass of water 2 hours prior to the procedure, strictly, but
Okay.
2.5 hours prior to the procedure he may have half a glass of water, say around 6 a.m., and
Okay.
he may present for the procedure 9 a.m. And in case for some people who may not be able to do it in the morning, minimum 3 to 4 hours of fasting, complete fasting, not even liquids, anything. It can be done at any time of the day, but preferably, since we have the overnight fasting lasts for like 6 to 8 hours, so it gives you a clean field to view, and even minor findings may not get missed out. So the instructions are pretty brief. Please come on an empty stomach, and do not take anything. And the prior day you can have whatever you want, and once it's over, you can just take a mild rest for 10 to 15 minutes, and then you
Yeah.
can have your normal diet. Yeah.
Oh, okay. All right. Okay. So, what exactly happens in the endoscopic suite? What would I be subjected to? Like, if I'm going to come inside your theater, is it done under the operating theater, or is it done as an outpatient procedure?
It's an outpatient procedure, Dr.
Okay.
Prakash.
So, how do you do? What exactly happens? Run me through that for the.
So some people may find it harrowing that somebody is going to insert a tube through their mouth all the way to the stomach. So
Exactly.
of course the apprehension is always there. I
Yeah.
think even when doctors, the apprehension persists. But believe me, it is quite simple, and off late it has become extremely, due to the advancement in technology. Basically, what was this size tube prior? It used to be the diameter of this is right now
Mm.
the diameter is just the size of my index finger. So the tip that
Index of
goes.
So it is how much is the diameter approximately? A centimeter or less than a centimeter?
It comes to around just 1.8 centimeter, Dr. Prakash.
Okay, 1.8 centimeters. So it is okay, less than 2 centimeters. But to swallow a 2 centimeter hard object, yes, I do have my apprehensions, of course. So, so do you give any sedatives or anything at all, or
We use a local anesthetic spray per
okay,
orally. So what
okay,
we do is once the patient is down on the couch and we
yeah,
explain it to him,
yeah,
the usually what doubt most of the patients have is that like they may have to hold their breath for entire 2 minutes or something. Nothing like
okay,
that. The first instruction we tell them is this entitles visualizing only your foot pipe and not your windpipe. So you need not hold your breath, and you can just lie down comfortably. You can breathe through your nose all through the procedure, and this tube will just visualize your foot pipe and will come out in 45 seconds. Mostly the timing is 45 seconds. And once he's on the couch, we use a local anesthetic spray inside the mouth, a lignocaine spray we
oh,
call it. Once
okay.
it is done, entire your throat gets anesthetized, and they do not have any sort of sensation or pain, or even the touch is gone. So they'll be pretty comfortable as long as its effects last for like 5 to 7 minutes. So they'll be pretty comfortable when the endoscopy is being done, and usually it gets over in 45 seconds to 1 minute.
That's it.
Yeah,
Just
one
45
one
seconds
minute
to
to
1 minute.
maybe you can add some just another minute if there is a small amount of biopsy or something is being taken. But at the
Hmm.
most, I would tell them it is within 2 minutes time span.
Oh, okay. So that's pretty cool, actually. So that significantly reduces my apprehension. It's not going to be like for
Definitely.
a long period of time I need to keep.
Yes, yes,
All
definitely.
right. Okay. And after having the procedure done, what
Okay.
should I expect after this procedure? Like, how would I feel? Will I feel groggy? Will I throat ache? Or what's going to happen? How will I be feeling?
Dr. Prakash, again, since you are in the ortho side of things, you are expected to a long period of post-op, instructions. But we are quite simple.
Okay.
Uh, after the procedure, they may have some numbness of the throat, which will, of
Okay.
course, just for 10 minutes or so. But
Okay.
after that, they do not have any sort of, we don't expect any after effects or so for this. And after 10 minutes or 15 minutes, they are free to take liquids. And then after half an hour, they can very well take their regular meal of the day, be it
Okay.
breakfast or lunch.
Okay. Will I be having sore throat for a couple of days following the procedure because I'm swallowing something raw? Is that the case, or no? It is nothing.
No, Dr. Prakash, because the tubes are entirely sterilized.
Okay.
So it is just like swallowing your food, actually.
All right.
So it is the same kind of thing. So we don't expect any sore throat or any of such conditions. Nothing per se, sir.
All right. Okay. So, see, yeah, when it comes to any kind of an interventional procedure, of course, there are risks that are associated with that. Now, in this particular procedure of upper GI endoscopy, are there any risks at all for the patient?
Um, the risks per se is that, as I told you, in preparing the patient,
Hmm.
I do expect that being a reasonable gastro specialty clinic which does an
Hmm.
endoscopy
Yeah.
will first screen the patient basically for his hard any pre-existing cardiac diseases, heart diseases, like he might be on any
Clean.
antiplatelet drugs, he might be on
Yeah.
treatment for
Hmm.
past heart issues, or he might
Okay.
be a sugar patient, so he may not be able to fast for a prolonged time. And
Sure.
of course, the basics always matters, like your blood pressure and your pulse,
Okay.
and even a simple thing like your oxygen saturation nowadays. So
Hmm.
all this will be, and a basic ECG, and a basic
Okay.
ECG the prior day. I'm saying in your office when you're prepping the patient on the day prior to the procedure, a
Hmm.
reasonable consultant would go through, and of course, just a normal blood test to show that his urea, creat, and hemoglobin values are within the normal range, and it's not grossly deranged. So
Okay.
once we have that, it's fine to do so.
Okay. But per se, coming to the complications of the procedure, are there any complications at all? Like,
Uh,
is there any risk of any aspiration or
No, no, Dr. Prakash. No,
no?
absolutely not. Because since we are doing it when the patient is totally conscious, I will say to my patients that this experience is just like you swallow your food.
Fine.
Even if he may have some retching or anything a little, the same thing will, I mean, the physiology will happen like when he retches out his normal food or saliva.
All
So we
right.
don't expect much of this to have. And as I told you, when a patient is extremely aged, in the aged population, he is already on treatment for his pre-existing cardiac disorders.
Yeah.
We will preferably tell him to uh, maybe we'll see that he has visited his cardiologist at least once in the past 3 months, and he is on his proper medications, he is taking his medications properly, and then we
Okay.
do not mind much. But of course, when a patient presents to us with grossly deranged, like cardiac diseases which are not yet resolved on the ECG, or
Hmm.
he may have a persistent cough which is
Hmm.
not resolved, and so in such conditions we do not advise him to undergo this immediately. We'll ask him to resolve those heart and lung issues, and then we may plan it subsequently in a few months' time. That would be the
Right.
best.
Okay. So, are there any limitations as a GI endoscopist for you to do the procedure at all? Or are there any specific group of patients apart from the medical contraindications, like as you said about any previous cardiac issues, etc., etc.? Are there any kind of an condition where you will not be able to perform this GI endoscopy procedure?
Yes, Dr. Prakash. There are some patients who may present with a gross pain abdomen with an
Okay.
undiagnosed inflammation of your peritoneum or your appendix or your pancreas. He may be in
Yeah.
severe pancreatitis. He may be in a severe inflammation, or he may be in active hepatitis. He may be in even the worst kind of cases where the patient may be bedridden, and we may suspect that he has a gross ulcer which has eroded and there is some etc. So when we have a clinical suspicion of these above said conditions, we will put them on conservative management first, and preferably postpone the procedure to a later date. That would be
All right.
best.
Okay. Now, coming back to the procedure, what you were talking about, is this procedure done with the patient 45-degree upright, or is it going to be absolutely flat?
Absolutely flat, like he is absolutely flat, and he would be turning towards the doctor's side on what
Okay.
we call it as left lateral position. In the bed, how you lie down turning to your left, they can
Okay.
just rest comfortably with even with a pillow. It does not matter, and it
All
can
right.
be in and out in 1 minute 30 seconds.
Right. Okay. Now, you did mention about uh, uh, grossly
I
this.
think the symptoms part we have not yet.
Yeah,
The main part is
exactly.
the indications for which we are going to do endoscopy.
Exactly. That's right. Yeah.
Uh, I think that would be an important one to discuss, because lots of people
Absolutely. That's what I was about
basically.
to come about. Yeah, sure. Yeah.
Yes, yes,
So
Chidappa.
you know grossly that it is done for food pipe, stomach, and also for the duodenum. So what are the specific conditions in this particular area that you do the endoscopy for?
Yes. So basically, people might be thinking about what are the symptoms for which I should undergo an endoscopy. So
Sure.
let's start with the throat part.
Okay.
So you'll be surprised to know that on a routine endoscopy, even some of the gross throat kind of masses, like your grossly enlarged tonsils, some of the throat cancers,
Mm.
etc., they get diagnosed when they come in for an unrelated endoscopy. So any symptom which obstructs your throat, you have
Mm.
difficulty in swallowing, you have even
Mm.
gross difficulty or sound while breathing, etc. Basically, the patient has a choking sensation. Is when we would do suggest an endoscopy in the throat part, and the main
Okay.
indication, of course, is the food pipe.
Mm.
So basically, off late, the trend is that everyone, they see a lot of Instagram, they see a lot of food influencers, YouTube, etc., and they
Mm.
want to try out every meal in town. So
Absolutely.
it will be a pleasure while trying out, but within a week, when they develop the gastritis part, that's when we step in.
Right.
So that's when they start having the symptom what we call as heartburn. It is what
Yeah.
is commonly referred to as heartburn, and basically they have a burning sensation in their heart, and whenever they start taking diet, it starts burning. Then they have to take something liquid in order to for the burning sensation to go away, and sometimes it may persist for weeks together. So burning sensation in the chest region, and of course an burn or paining sensation in what we call as the epigastrium or your upper stomach. When you
Okay.
have gross pain or any burning sensation in your upper stomach, of course I would tell that that is a symptom when you have taken a really spicy dish of Chinese or something, the sensation that you get. So when that persists for weeks together,
So
that is what is called.
you call the Chinese food as spicy and not the Indian food as spicy.
Okay, every side has their own spiciness, I guess.
Sure. Sure. Yeah.
Definitely.
All right. Okay.
So that is a sensation when it persists for weeks together. I think you get my point. When that
Yeah. Yeah. Yeah.
sensation
Sure.
persists for weeks together,
Yeah.
that is what we call it as medically. It's called as acid peptic disorder, or
Okay.
in the local terms, it's called as gastritis or acidity.
Okay.
It's quite common these days. So that is your number one indication for your upper GI endoscopy.
Sure.
So
Yeah.
that is with regard to your food pipe and the stomach. And
Yeah.
of course, ulcers, as people they themselves may be knowing, when these symptoms persist for weeks or months together,
Mm.
uh, the lining membrane of their stomachs may get eroded, and that is when
Sure.
we call it as an ulcer. So an
Okay.
ulcer pain is one which, whenever you are even 3 hours after food, you start having that gnawing sensation in your upper stomach, wherein you have to take something immediately, whatever it may be.
Okay.
So that is what is called as the gastritis, pain of gastritis. So that is
Sure.
the number one indication for yourself to get checked yourself on an upper GI endoscopy.
All
So
right.
any pain basically of your upper abdomen. And next, coming to the distal part of the stomach, the same thing.
Mm.
When the ulcer is in your the lower end of your stomach, the pain may occur all over your abdomen, And
Okay.
even some people may just, middle of the night, they start having the severe pains. They may
Mm.
mistake it for an uh, heart attack, and they may
Angina.
go to the
Yeah.
cardiologist.
Mm.
So it may be that kind of severe, but of course, the ECG, he may be a young patient. He may be just around 30 years of age, not much comorbidities. So it is a usual confusion which happens in medical casualties all around the globe. And after
Absolutely.
basic ECG, they'll tell him that it is nothing but acidity pain, and
Yeah.
basic injection of your antacid will cure that pain within 30 minutes. That itself will show you how severe the symptom was. And after
Okay.
that, they have to undergo an upper GI endoscopy to know where exactly the pathology lies and how deep the ulcer is, or is it cross the stage of ulcer? Are there any this thing? And of course, the second indication is what we call as varices. You know, sometimes rarely people may spit out blood,
Yes.
vomit of blood.
Yeah.
Uh, it is what the condition we call as your dilated veins inside the foot pipe, which we call as varices. So it
Absolutely.
occurs in mostly in people with excessive use of alcohol for
Yeah.
a prolonged period of time.
Mm.
So they would definitely in I believe in US and other countries, they have a strict screening endoscopy which should be done at 45 years of age to rule
Mm.
out all this. And after that, it is like left to the person and his symptoms. But after the age of 45, in countries like US, it is mandatory to get an upper GI endoscopy done.
Right. Okay. So these are the indications wherein you commonly perform
In
GI
upper GI
endoscopy.
endoscopy. Sorry,
Okay.
I forgot to mention the small bowel part. The small bowel part is where your, of course, when the food just does not pass through your small bowel also, we may
Mm.
find one or two swellings or, tumor-like conditions. Mostly that is found near the part that we call as an ampulla. It's
Okay.
the place where your bile duct drains into the small intestine. That is
Mm.
also visualized on regularly on an upper GI endoscope. So
Okay.
regions surrounding that are also prone to get some, in elderly people, they are prone for certain tumors at that region. So that
Mm.
is also an extremely important indication for an endoscopy.
Right. Okay. Now, thanks for elaborating on the various indications of for performing this endoscopy. Uh, I'm sure with the evolving medicine every day, there should be advances that should be happening in endoscopy and stuff like that. Is there any kind of a thing that in the recent advances, rather than subjecting to a patient to swallow this 2 centimeter tube inside, etc.? Is there any other non-invasive kind of a easy kind of a stuff that is available at all for the general public where they will be able to avoid ingesting themselves with a 2 centimeter tube? Is there anything that is happening now?
Yes, Chidaba, of course, there is an recent advancement. It is extremely brand new, which is called as the capsule endoscopy.
Yeah.
uh, Capsule endoscopy, which a lot of internet searchers do throw it. I mean, they show it up. It's a very recent investigation, of course,
Okay.
but it is an ongoing work, and I would say it entitles just swallowing a capsule
Yeah.
through your mouth. It
Yeah.
contains a miniature chip and a camera, and as
Mm.
a capsule travels through your food pipe, stomach, and the large bowel, it takes pictures at a random, which are then analyzed to look for certain disorders.
Okay. So it's a rather picture rather than a video, is it, or is it continuous
Uh,
motion?
yeah, the video part is mostly not of much use because of the rolling around. The
Okay.
pictures that it takes at frequent intervals of each section of the bowel that it travels through are
Yeah.
more informative. But having said this, I should tell you the biggest drawback between
Mm.
of this capsule endoscopy is that uh, uh, a good consultant who is doing an endoscopy, when he notices even the most minor change, like I'm saying, the starting point of an cancer inside the stomach, he can focus on that area and he can pick it
Pick it
up.
up.
And of course, biopsy can be done. But
Yeah.
mainly, the focusing and the going near that place is possible when he is doing the endoscopy,
Yeah.
whereas the capsule may miss it. Yes, the
Okay.
capsule just miss it.
It
Yes,
just passes through, so you
yeah, it
cannot
just
control the
zooms through.
motion of the capsule. No.
It is like zipping through your highway at say 100 kilometers an hour. You may not be able to read the shop sign when you're zipping through the highway. So that is
Yeah.
the example I would use.
That's a
Yes.
nice analogy. That's right.
Yeah.
Yeah. Okay. So it's better in that case to swallow the 2 centimeter tube and just be there for 45 seconds rather than missing out some
Yes,
important diagnosis, especially with the modern technology. And I'm
yes,
sure there will be some updates that might be coming in the future where we'll be able to control the motion that happens of the capsular endoscopy. If that happens, it might be a boon. Fantastic,
maybe.
Dr. Karthik. Is there anything else at all that you would like to let know our general public regarding upper endoscopy, either regarding the apprehension or regarding the procedure? Anything that I have missed that you would like to appraise them of?
I think you have done a very nice round of Dr. Prakash. Almost all topics are covered, and
Fantastic.
yes, nothing has been left out. Uh, of course, it is a very easy procedure to get it done, and I think after this blog might solve all their doubts and remove any apprehensions that they may have about undergoing the procedure.
Absolutely. For people who are seeing this particular blog, if they want to, if they got any queries or anything at all, kindly do not hesitate to write your comments over here. I'm sure Dr. Karthik will be
Most
able to
welcome.
clear all the doubts that you have got.
Most welcome.
Fantastic,
Definitely.
Dr. Karthik. Much appreciated, and I look forward to seeing you in many more sessions to come in the very near future. I think the next session is going to be on lower lower GI endoscopy.
Lower GI endoscopy or the colonoscopy part.
Yeah, we will do that on a later date. Until then, thanks a lot, Dr. Karthik. Appreciate it.
Thank you for having me, Dr. Prakash. Pleasure.